Hello friends, welcome to Ayursure classes. Today we are going to briefly discuss the different categories of antihypertensive drugs. Before I really move on to the topic, let me highlight few basic but important aspects of blood pressure and hypertension as well for easy understanding of this topic. So friends, let me share my presentation. So friends, why this video? In this video, we will learn the basics of blood pressure and hypertension. We will have a quick revision of major classes of antihypertensive drugs. And I'd also like to highlight the different points which are very important for solving multiple choice questions. So now let's define what is blood pressure and what is hypertension. Blood pressure or systemic arterial pressure refers to the pressure measured within the large arteries in the systemic circulation. But defining hypertension is a little bit more complex because hypertension depends on so many factors. So any blood pressure measuring more than 140 millimeter of mercury in systolic and more than 90 millimeter of mercury in diastolic is considered hypertension. So blood pressure is mainly dependent on three factors: cardiac output, arterial elasticity, and systemic vascular resistance. So if we want to reduce blood pressure, then we have to reduce cardiac output or systemic vascular resistance or both. All our antihypertensive drugs act by modifying these factors only. Now, we need to understand what is cardiac output. So, cardiac output is the product of stroke volume and heart rate. If either of these two factors are reduced, then cardiac output will be ultimately reduced. And if you are able to reduce the cardiac output, we will be able to reduce the blood pressure as well. Now, we will remember the different categories of antihypertensive drugs with the help of a mnemonics. And this time, the mnemonics is A3, B, C, D. You have to remember A, B, C, D only, but there is a little change. A3, B, C, and D. Now, coming to the classification. In classification, we have three categories starting with the letter A, one category starting with the letter B, one category starting with the letter C, and one category starting with the letter D. So now, let us remember what are these categories. We have said 3A, 1A for ACE inhibitors, 1A for ARB or angiotensin 2 receptor blockers, one more A for the alpha blockers, B for beta blockers, C for calcium channel blockers, and D for diuretics. That makes A3, B, C, and D. So how to remember the names of the drugs in different categories? Suppose if it is a ACE inhibitor, then the name must contain pril. For example, enalapril, ramipril, etc. If the drug is angiotensin 2 receptor blockers, then the name must contain sartan, telmisartan, losartan, etc. If it is alpha blocker, the name must contain zosine, doxazosine, prazosin, etc. If it is a beta blocker, then the drug name must contain LOL, L-O-L. For example, atenolol, metoprolol, etc. If it is a calcium channel blocker, then the drug name must contain Dipine, amlodipine, nifedipine, etc. And if it is a diuretic, the drug name must contain IDE. For example, hydrochlorothiazide, furosemide, etc. Now, coming to the mechanism of action and the ultimate effect by which they reduce the blood pressure. First, coming to ACE inhibitors. The ACE inhibitors act by inhibiting angiotensin converting enzyme. By doing these, they reduce the systemic vascular resistance and stroke volume as well. Now coming to ARB, angiotensin 2 receptor blockers. They block the angiotensin 2 receptors. By these, they reduce both systemic vascular resistance and stroke volume as well. Now, alpha blockers. The alpha blockers are present in the blood vessels. By blocking these alpha receptors, we will be able to reduce the systemic vascular resistance. Now, beta blockers. As we know, beta blockers are present on the heart. If we block these beta receptors, then we will be able to reduce the heart rate. Now, calcium channel blockers. The calcium channel blockers block the calcium. So, what is the main role of calcium? If we prevent calcium from entering the heart muscles, then the force of contraction will be greatly reduced and the vessels will also relax. So ultimately, they will be reducing the force of contraction of the heart and also systemic vascular resistance. Now coming to the diuretics. The diuretics will increase urination. If we increase urination, the stroke volume will be reduced, and if the stroke volume is reduced, as we know, the cardiac output will also be reduced, and once we are able to reduce the cardiac output, we will be able to reduce the blood pressure as well. Now we will discuss the compelling indications and compelling contraindications of different antihypertensive drug classes. We'll start with ACE inhibitors. The compelling indications are left ventricular dysfunction, coronary artery disease, and very important, type 1 diabetic nephropathy. ACE inhibitors are contraindicated in pregnancy and renovascular disease. Now ARB, angiotensin 2 receptor blockers. So these category are very rampantly used nowadays. We should remember the compelling indications of this category: left ventricular hypertrophy, type 2 diabetic nephropathy is very important, and ARB are also contraindicated in pregnancy. Now alpha blockers. So alpha blockers are indicated in hypertension along with BPH. They are contraindicated if the patient is having urinary incontinence. Beta blockers. They are indicated in treating hypertension along with MI and cardiac failure. They are contraindicated in asthma and COPD. Calcium channel blockers. We use calcium channel blockers to treat hypertension in older patients, in isolated systolic hypertension, and calcium channel blockers are strictly contraindicated in atrioventricular plaque. Now diuretics. Diuretics are also used to treat hypertension in case of older patients, just like your calcium channel blockers, and isolated systolic hypertension and in cardiac failure. Diuretics are contraindicated in hypertensive patients with gout. Now we'll discuss the major side effects. Usually we get so many questions from the side effects of different antihypertensive drugs. We get so many MCQs from this segment. So please remember, ACE inhibitors, the major side effects are dry cough. Why dry cough? Because ACE inhibitors inhibit bradykinin metabolism. So bradykinin level gets up, producing dry cough. Now coming to the angiotensin 2 receptor blockers. The major side effect is dizziness. Alpha blockers. Alpha blockers can have very serious side effects like postural hypotension and sexual dysfunctions as well. Beta blockers, particularly the non-selective beta blockers, which do not discriminate between the beta 1 and beta 2, and they block both. So that is why they can precipitate bronchospasm, and in the contraindication section, that's why we said beta blockers are contraindicated in hypertensive patients along with asthma and COPD. Now calcium channel blockers, times and again this question has been asked in previous exams. The major side effects are pedal edema and gingival hyperplasia. Now coming to diuretics. Diuretics can produce electrolyte imbalance and hyperuricemia. So that is why they are contraindicated in patients of gout. So thank you. I expect you people must have liked this video. So thank you once again.